Hello and thank you for having me. My name is Christine Platt and I am the Geriatric Systems Implementation Facilitator for the Waterloo Wellington Older Adult Strategy. And today I'm presenting to you the Self-Advocacy for Healthcare Conversations workshop, a workshop that was developed by the Older Adult Strategy Community Network. And I am going to start off with what we heard through the focus groups that we brought together to create this workshop. So we brought focus groups of older adults, we brought focus groups of caregivers, as well as health service providers to find out what they felt was most needed in our region in terms of healthcare services for older adults. And by and large, the topics that came up were the difficulty of navigating the system. They talked about how complicated it is. They talked about how challenging it is to get the healthcare they need. They talked about wait times, the scarcity of resources, and things of this nature. Now, we know that with one workshop, we can't fix the healthcare system. However, what we can do is look to strategies of how to better navigate the system. And so what we've zeroed in on here is how to navigate the conversations themselves. So today, we're going to focus on what older adults and caregivers can do themselves in just about any healthcare conversation. That's healthcare conversations you're having with your primary care physician, a nurse practitioner, in the hospital, with home and community care support services, etc. And then we're going to teach some strategies that are helpful to be used within these different contexts. So, a self-advocacy approach is first about recognizing the system in which we currently function. And the system that we would love to have, of course, is one that has a clear path where access is fair and there's not a lot of effort required. Like this lovely moving walkway, you could jump on it and it would take you exactly where you need to go. However, this is really what our healthcare system looks like today in Ontario. You can see in the photograph, it's a bit of a maze. It's incredibly complicated. The path is unclear. Access is honestly unfair quite often, and there's a lot of effort required. So what can you do to navigate this system and have a more smooth journey and get more of what you need out of it? So the approach that we're suggesting is a self-advocacy approach, which really means you need to be more active in your approach to your healthcare, or in the approach to healthcare for the person that you are supporting. And so we're breaking down this word active into its separate components for you here. And the first one is adopt an attitude of self-worth. So adopting an attitude of self-worth is recognizing that your experience of healthcare is important, that it matters, and that when you go into a conversation with a healthcare provider, you need to put that at the forefront. Centering your needs follows very naturally from saying, okay, it matters, but also I need to tell them what I want from this appointment. I need to tell whoever I'm speaking with what I need for my healthcare journey to improve and not fall victim to the situations in which someone else finds it inconvenient and pushes you aside. Taking up time, space, and resources. This one is really about how complex older adults' health care tends to be. And it's a natural progression of aging that you will have more and more that you have to deal with over time. And that's expected. The healthcare system is aware of that. And so it's okay to take up those resources. In fact, there are a lot of resources specifically earmarked for older adults. The OHTs, the majority of them across the province of Ontario, will have at least one of their priority populations as older adults. So know that the resources are there for you, but you do need to really work hard to make sure you get them. Identifying your rights is figuring out what you're actually entitled to, and this will help you know when in a conversation your rights are being skirted, or there's a problem somewhere that you can address and say, hey, wait a minute, I'm entitled to this. This is a legal right of mine, so please let's focus here. Valuing your support system is one that we don't always talk enough about when we're talking about healthcare. And that is looking to your friends, your partners, your children, your neighbors, and the wider community, and recognizing that you don't need to do this alone. With this complicated system, in fact, you're not expected to do it alone. You're expected to do it with some help along the way. And if help isn't immediately obvious to you, you would be surprised when you reach out who's available to support. So really value the people around you in your community and make them a part of your healthcare journey. And then expecting challenges. Getting what you deserve does require self-advocacy in our current healthcare system. And by using the strategies that we're going over today, it will make it more efficient, but it's not going to break down every obstacle or challenge. So you have to keep that in your mind so that you're not surprised or frustrated every time that an obstacle comes up. So the self-advocacy approach active part is about your mindset. This is about how you're going to approach it from an attitudinal perspective. When we talked to different members of our focus groups, the things that they found the most difficult about this ACTIVE acronym was taking up healthcare resources when the system is already burdened. And over the last couple of years, particularly in our atmosphere and our environment of pandemic, we know that there is a scarcity of resources. We know that the system is burdened. However, I want to remind everyone that you do matter, and that there are resources there if you can find them specific for older adults. And that if you take up those resources now, you actually take up fewer resources along the way because you're addressing an issue before it gets worse. It's hard to admit that I need more help. And this I completely understand. And I will say that this great generation that many of you are from is one of huge strength and great pride. And it's something to celebrate. But by the same token, it's okay to need help. It's okay to want help. And to show that vulnerability is a really wonderful thing. It's its own kind of strength as you actually help yourself and help the system at large when you do that. And then the last there, I don't want to repeat myself again and again. It feels desperate. And I can understand it's a frustrating thing to have to repeat yourself, but just remember that most healthcare providers have hundreds of patients on their roster. So it is actually very helpful to them if you do repeat yourself so that they can remember, okay, what is the complexity of this patient? What are we dealing with here? Remind me of where we're at. You're actually helping the expert do their expert work by repeating yourself. So you've got your active mindset, you're centering your needs, you're going, I'm going to be comfortable. I'm going to, go in there and I'm going to take up the resources. But how do you actually do that? What actions do you need to take? And this is where we get to the speak strategies. So when we break speak down, we start at home. And I grew up as a Girl Guide and in the scouting movement. And this really sits well with the whole motto of be prepared. The more prepared you are before you go into any healthcare conversation, the smoother it will be. So do what you can ahead of time. Review those notes, figure out what it is you want from the appointment before you go into it. Presenting requests is all about what do I need to ask for? What accommodations do I need for this appointment to go smoothly? Explaining your issue, this is the crux of what you're doing. Tell your story. Tell your story when you first go in as clearly as you can so that they are aware of what's going on, and make sure you choose 1 to 2 priorities so that they know what you need from that conversation. And then asking to understand. So we can have all kinds of appointments with lots of information, but it's often too much information. It's often too fast. So it's important to know what to ask and how to ask it so that the conversation can be slowed down and you can gain more clarity from it. And then keep asking is really about, okay, at the end of the appointment, what do I need to ask so that I know what to do before my next appointment, for the follow-up, things of that nature. And then also keep asking after the appointment for that support from others, for help understanding, for help getting extra services that are non-clinical, for instance. So that's where keep asking is about. So I'm going to break these down for you now. Any good healthcare conversation starts before you get to an appointment, and advocating for yourself always means having some kind of game plan. So I want you to think about how you prepare usually for your appointments. Now, when we did our focus groups, they came up with a number of things that you can do to prepare for your appointment. And the first one there, black binder to a red purse, is really about where are you going to put information? How are you going to keep everything organized from all of your appointments? And it's really important that you choose a strategy so that when you're preparing for each of your appointments, you can look over past notes, reports, and really figure out, what am I going to talk about here? And the red purse was a lovely story of an older adult who had some very complex chronic conditions. And she said, they were rather depressing to her to have to look up before the appointments. So she chose a red purse because that made her smile. That made her think, well, isn't this beautiful? And it's important that when you're picking a strategy for organizing your materials, you're also picking strategies, not just at that point, but throughout your journey, that give you moments of repose, of respite, that make you smile, that help you get through what can often be a very challenging experience. Keep an updated health history timeline. So there are wonderful tools available that you can use to do this, or you can write out your own. But I would suggest you put together a timeline that goes childhood, early adulthood, middle ages, and then when you get to the 50s, break it down by decades. When you go into an appointment, on average, it's 8 to 15 minutes long. You don't have a lot of time to recall information or to look things up. If you have your health history timeline and the doctor or the nurse asks you a question, you can pull it out and go, yeah, that happened when I was 56 years old. I had that surgery. There were no complications, etc. Bring yourself to each appointment. What this means is really take the time to review your notes ahead. Again, so you're not taking time up in the appointment to recall or to understand what happened previously. Remember, set those priorities. 1 or 2 is your maximum for each individual appointment. If you go in with a long laundry list of priorities, unfortunately, you're not going to get any one of them a good, fulsome answer. You're going to waste your time amongst them all. So when you tell your story, if things interrelate, that can go into your story. But when you ask, you make your ask, choose 1 or 2 to focus on, the most important for that appointment. List and pack up all your medications. And a good tip is there are a lot of pharmacies out there who will actually print a list of your medications and your past medications for you. So you can just bring that with you. And if there are any questions, you have it there. And then find out what's expected of you. Do you have to do anything before you're going to this appointment? Anything around eating, anything around drinking? Do you need to fill out any forms? What's the parking situation? Ask those kinds of questions and get that information before you go to the appointment. Starting at home is also really about including those support people. Include them if they can come to the appointment, but include them before as well. Talk through what it is you want to get out of the appointment, and having that other perspective will help you think of questions, will help you think of priorities you might not have thought of. Those people, if you're setting them up to come with you, can be helpful in listening. They can be helpful in note taking. Of course, language interpretation or cultural interpretation if you need that, physical assistance, and don't diminish the need for emotional support. Big things happen in medical appointments, and it's very important and very difficult to hear what a provider is telling you if they've just given you some kind of intense, complex diagnosis. So having someone to speak through the appointment ahead of time and during and after is a great thing. So you've got your active mindset, you've prepared for your appointment. Now you're going to present your requests, and that might be a telephone call ahead of time, or it might be at the very beginning of the appointment. You need to take the time to communicate what you want from this appointment in order for it to go well. So what do you need for your appointments to go well? Have a think about that. And here's some of the ideas that we came up with. It would help me if you could write down keywords as we go, or tell me what you're writing on the computer so that I feel included. It's really hard to understand when somebody starts talking like that to you, right? You need them to face you when they're explaining something and not just write their notes. Speak slowly and facing me so that I can hear you, or allow me to record our appointment so that I can listen again later. So in Canada, it's perfectly legal for you to record any conversation that you are a part of. We do suggest, because healthcare relationships are generally relationships that are ongoing, that you do request it. Say, could I record this so I can take notes later for that piece? But legally, you are entitled to do that at any time. It would help me if you could speak directly to me or directly to my support person. So perhaps you've brought someone with you, and maybe that person is there in person, or maybe they're on the phone, or maybe they're on the video, depending on restrictions and abilities. Maybe someone lives far away, but let the healthcare provider know, who are you speaking to? Is this person coming in a part of this conversation, or are they an observer? Let them know what you need. And then definitely ask to have a support person there. Because it's helpful. Again, there's a lot of information being delivered, and to take notes and listen and comprehend all at the same time, especially if you're not an expert in healthcare, takes a lot of energy and a lot of practice. So include those people. And I'm going to give an example of a request that my husband always makes now that he is post-concussive. He has trouble with lights. So when he goes into an appointment, he will say, excuse me, could you please close the curtain or dim the lights, something to that effect, because otherwise he finds it very difficult to understand what's going on because the lights are actually hurting his head. So these kinds of accommodations should be presented right up front so that you actually can really absorb what's happening during your healthcare conversation. So you've got your active mindset, you've prepared ahead, you've presented the request that you need for your appointment to go well. Now you've gotten to the crux of it, explaining the issue. Why are you there? It is so important to clearly communicate why you're at this appointment or having this conversation without minimizing it. There's a little bit of the squeaky wheel gets the grease in this, because we know that we're under constraints in our healthcare system. You need to speak up and you need to highlight what you need, what your issue is. Don't make it smaller. So I want you to think about your last medical appointment. Were you actually able to convey how you were feeling during that appointment? So the first step here is the service provider comes into the room and they say, hey, how are you doing? And we have a bit of a cultural response in which We minimize automatically what's going on and we give it a positive spin. Oh, I'm doing all right, all things considered, or these are tough times for everyone, of course, and fit as a fiddle. But you're at a medical appointment. So if you're having a healthcare conversation, unless this is your biannual physical, which I don't know how many people get to have those right now in this circumstance. If you're going to an appointment or having a conversation with a healthcare provider, something's going on. You are there for a reason and you are not fit as a fiddle, or you wouldn't be there. So 8 to 15 minutes is that average appointment time. Tell them how you're feeling right away. The professional comes in, says, "How are you doing?" You say, "You know what? I am feeling rubbish. My hip still has a pain in it. I've done the exercises you've told me, the pain's not going away, and it is stopping me from being able to walk and get my mail or to take my grandchildren to the park. It's a real issue." Really lead with what the problem is. When you're explaining your story to a healthcare provider, you're doing two things. The first thing is helping them to understand what it is you need. So you're going into the appointment and you're saying, "Hey, this is what's going on with me, and this is what I need from this appointment." And the other thing you're doing is showing them what you understand. Because by showing them what you understand, by saying, "This is my story, this is what happened before, and this is where I'm at now," you're telling them you understand what they've already told you before so that they don't have to waste time repeating it. And they're also doing a couple of cognitive checks on you to make sure that you're following everything that's going on. So it's really important to explain your problem without minimizing it. We have a quote here from an older adult who works in healthcare. And she says, "Most patients don't know that repeating your story to health service providers actually has a specific purpose. It is to validate that you understand what your diagnoses and treatments are. Also, it is to ensure you haven't forgotten anything." And this is actually taught now in medical schools. So as frustrating as it can be to repeat yourself or to tell your story over and over to each professional, there's a real purpose there and they're going to keep asking. So they've come in, they've asked you how you're doing, and you're going to say, "I'm not doing great. Today I'd like to talk about a new symptom that has come up." Or perhaps you want to talk about your medications, that you've been on a couple of medications for a long time now. Should you still be on these medications? And a great tip on that one is if your doctor is uncertain or if you're uncertain, they can connect with someone called GeriMed Risk. This is an interdisciplinary team. It is free for healthcare providers to use. And what they do is they look at your medications and your health history and they optimize. They figure out what is the best number of medications for everything going on with you. And this is a geriatric pharmacist, a geriatric psychiatrist, and a geriatrician. So some real experts coming together and figuring out exactly what you need. You might ask, "Can we talk about the next steps for one of the diagnoses that you've received? Or can we talk about a change in my situation? Maybe your environment at home has changed and that's affecting your health. Maybe there are stairs now, and how is that affecting, for instance, that pain in the hip or something to that effect?" So you've explained your situation, but quite often you feel like maybe your key concern is being dismissed. Maybe the healthcare provider has asked some questions and taken you on a different path away from what you need and want from this appointment. Here are some of the top things that healthcare providers have told us you can do to get their alarm bells ringing. So the first one is to focus on impairments to function. So what that means is something that is stopping you from living your daily life effectively. So the problem is so bad that I cannot cook for myself. Maybe it's arthritis in the wrist. I can't pick up the pans now. That's a serious issue because it is stopping you from functioning on a daily basis and definitely from aging in place. Another thing you can talk about is your pain. So rate your pain and give your scale. So I always use the scale of childbirth because that's when a lot of people seem to understand. And I say, where 10 is having a baby, my pain is a 6 right now, but it's a 9 at night. And so I've given the scale, but I've also given a framework in which here's what it feels like right now, and here's what it is at its worst, and when that happens. That's giving some essential information to them. And it's also addressing that problem where if you're anyone like me, by the time you get the appointment, suddenly that pain, that issue is not as bad as it normally feels while I'm talking to the healthcare provider. And I go, but it is really bad, but right now it's not as bad. That's okay. Tell them when it is at its worst. Explain more. And then the other thing you can always do is use gentle persistence, because it's okay to state your problem several times if that's what you need to do, and bring them back to what you need in your appointment. So my hip is not improved. Can we please talk about that again? Just bring them back to what you need. So you've got your active mindset. You're centering your needs. You're going to take up space. You've prepared ahead and reviewed your notes. You've presented your requests for any necessary accommodations for that appointment to go well. You've involved your support people. Now you've explained your situation. You've used some different strategies to ensure they know what you need from that appointment. But throughout the appointment, as they explain things to you, as they ask more questions, as the flow goes forward, you might need to ask some questions to slow it down or to better understand. So what makes a healthcare conversation hard to understand? It's hard to understand healthcare conversations because they can happen too quickly. The speed is very quick, the appointments are very short. It can happen because complex ideas are being presented, or new words, medical jargon is being used, or they're assuming that you know more than you maybe do know about a particular issue or diagnosis. They force decisions on the spot. Legally, you usually have at least 24 hours, unless you are in an absolute emergency situations, to make your decisions. So do take the time that you need and let them know, hey, I need a day before I decide what I'm going to do with this. And discussing sensitive or personal topics. This can be really difficult because for a lot of us, there are certain topics that we aren't comfortable discussing. And we need to remind ourselves that when it comes to healthcare providers, there's no taboo around it, and they're not looking at it in the same way we are. They are looking at it from a purely medical standpoint. So it's important to put that in our minds when we do need to talk about something that feels sensitive to us. So how do we do this? How do we slow that conversation down? Because if we ask for more time at the front end, and sometimes you can try and book appointments back to back so that you have to, but not every place will allow you to do that. And a lot of places, if you say, can I have more time? They'll go, no, sorry, we just don't have the ability or the capacity to do that. So you need to build it into your conversation. And so some of the things you can do to slow that conversation down is, please explain this a bit more. A very simple sentence, but very effective, more effective than saying, can you slow down? Because quite naturally, when someone does slow down, they very quickly resume their usual pace. It's just a natural flow of how we communicate. Another sentence you could use, can you tell me what that word means? This one is incredibly effective because this one not only gets you a definition of a word you might not have understood, but it stops the healthcare provider in their tracks and it tells them more information. You don't understand this word. Maybe I need to change my approach and how I'm communicating this. I forgot that everybody is not in this world every day and knowing all that's going on. Can we write down an action plan together? This one is better for some situations than others. Definitely better with, for instance, a nurse practitioner, physiotherapist, pharmacist, these sorts of people. A lot harder to do sometimes with your primary care physician, but definitely ask and see what happens. You might be surprised. Or, I didn't get that. Can you say it again? Again, very simple sentences that can slow that conversation down. Other times we need to clarify. You're hearing everything. The conversation isn't too fast, but the information is so complex that you need to slow the conversation, or you need to get clarity. So you can have this talk back strategy. You say something like, "This is what I'm hearing you say. Is that right?" Or, "If this happens, what are my options? What can I do?" Or, "I thought you said this. Is that what you're saying?" Make sure that in your own words and your own understanding, it actually matches what the healthcare provider is explaining. And then those wonderful questions back from primary school days, the when, where, why, and hows. Ask as many of those as you can because it will give you clarity. So maybe they're saying, "I'm going to refer you to a specialist." Okay, when is the appointment likely to happen? Where will that take place? Why that specialist? How am I supposed to prepare for that appointment? What can I do while I'm waiting for that appointment? So you've gone through your appointment, you've taken your notes, you have the right mindset, you prepared, you got your accommodations, you did a really good job of explaining your needs and your story. Now it's the end of the appointment. What are those last few questions you need to ask, and what do you need to do after? So navigating care can be very overwhelming, even if we're staying engaged and listening the whole time. It's important to stay curious. It's important to stay curious throughout as well as afterwards. So what can you do with your unanswered questions at an appointment? Well, you can always ask, and I encourage you to always ask for your reports, notes, or printouts from that appointment. That is your personal health information. You are entitled to always have it. And they may charge you if you do your whole file at once. But if at each appointment you say, "Excuse me, could you please print that, email that to me?" There should be no qualms about it because it is your personal health information. You should book your follow-up appointment right away. Book it so that it's in the system so you don't have to worry later down the road. You should ask who you can contact for more information. So the doctor, for instance, might not have a lot of time to go over what a diagnosis really means, but they do know people who can help you go more in depth. So let's say it's something around dementia, they should be pointing you to other resources like the Alzheimer's Society, where there are people who have a lot more time to go through the condition with you and a lot more resources. You can ask for support from other professionals. So if you're with a family health team, congratulations, that's the best place to be. Um, they often have connected to them nurse practitioners, counselors, dietitians. If you're not, don't fret. Every primary care physician should be able to refer you to other health professionals to help you with whatever's going on, including those counselors, dietitians, physiotherapists. This Each appointment does not end with the person that you are speaking to. There are always more people who can give you support and information. And then ask for those suggestions. What do I do while I'm waiting for my referral? Because let's be honest, there's often long wait lists. One of the amazing things you can ask for is an e-consult. An e-consult is free for doctors to use. And all they do is they email a specialist and say, "Here's the situation. Is this what I need to do, or can you give me advice?" As long as it's not too complex, within 5 days, they will get a response. And then you might not have to be on that wait list at all, because oftentimes there are folks on wait lists who it's because your doctor isn't the expert, but they actually only need a small answer. Now, if you're on the wait list for something bigger and you do need that more complex care, there are always things you can do. Ask them, is there a change I can make to my diet? Is there something in my mobility? Is there something in my engagement socially that I can change that will help me from stopping this condition, from accelerating, from stopping my situation for deteriorating? So ask those questions. And then your appointment has ended. You've gone through everything and you need to keep asking questions. You need to stay curious. Ask other supports in the community. Go to your community center. Go to the social workers. Go to your pharmacist, who's a great resource and often has that little bit more time. And it doesn't just have to be specific to the medication. They have a lot of medical knowledge that they can share without an official appointment. So go and ask those questions. Talk through what happened at the appointment with another person. Because again, having that sounding board, they might give you a perspective that you didn't think of yourself. They might help you refine your questions. They might actually have an experience to share with you so that you can get information and do the same thing they did or avoid what they did. Definitely get online and look things up with the caveat that you need to make sure your online resources are legitimate. I always say when it comes to medical knowledge, if there's a university attached, a hospital attached, a governmental organization attached, you can feel pretty comfortable that the information they're giving is scientifically proven. So be careful. Be careful with what you look at online, but use it where you can. And then join a support group to talk about your medical questions. You know, there are so many groups out there, and by and large, what we heard from the focus group members was they were often the most helpful when you get a new diagnosis, when you're caregiving, when you're trying to navigate the system, because they've done it themselves, and they will share their wisdom with you of how to get through it all. And this one, I know you're all polite people, but after your appointment, you would be amazed at how far appreciation goes for health service providers. The health service providers that we spoke to create this workshop, by and large, said the person who showed appreciation, sincere appreciation, they made our day. We're working hard. We do want to do our best. It's a tough situation. And sometimes it also propelled them to go that extra step. This person was so grateful. I put in an extra call just to put them on that urgent wait list instead of the regular wait list, because there are two wait lists in most cases. And putting your name in the urgent category can get you that appointment earlier. So, I made the extra call. They were just so wonderful. So say thank you, show appreciation. It really helps to go through. So I just want to do a quick recap here. You have put yourself at the center and gone, I am worthy, I am important, my healthcare experience matters. You're being an active participant. You've got that mindset. You've prepared for your appointment ahead by starting at home and including your support people. You've presented your requests and said, this is what I need for this appointment to go well. You've explained your story. You may have had to repeat it a few times, but you know the value in that. You have gently brought whoever the healthcare provider is back to your needs, probably multiple times, so that they will address them using your different strategies like impairment to function, pain scale, and gentle persistence. You've asked all the questions to help slow your appointment down, and you've asked the questions for clarification and for further supports outside of that appointment. And then you're going to keep asking. You're going to keep working at it. You're going to keep involving that support community, and you're going to say your thank you. And hopefully each of those appointments that you go to, each of those conversations you have are going to be a little bit more efficient, a little more smooth, and help you address your needs when you are accessing healthcare. So I want to say thank you so much for joining us today, and a big thank you to our older adult strategy community members network for putting this together.